Dear colleagues, this is an unedited video of a cataract surgery. Let us see how the surgery proceeds. The main incision has been made. This is 2.8 millimeter main incision. This is a side port on the left side of the main incision. Now in this case, I have planned to stain the capsule so that I can show capsulorhexis to my trainee fellow. The anti-capsule has been stained underneath an air bubble with trypan blue dye. The dye is washed out. Now viscoelastic substance is injected into the anterior chamber. This is HPMC, hydroxypropyl methyl cellulose. The anterior chamber has been filled up by this OBD. Now this is an incision on the anterior capsule. I hold the capsule now with uterata forceps. In this case, I have made only one side port. The rhexis has been completed. Now hydrodissection is done. This is very important. As the fluid wave goes to the opposite equator, we must stop injecting fluid. The nucleus is then gently rotated and it becomes free from its capsule. HPMC is again injected, and now is the time to enter into the eye with the phaco handpiece. We are going to use Ophth Cataract Easy phaco machine in this case. This is direct chop. Just impale the tip into the nucleus and chop it. This can be called a combination of horizontal and vertical chop. In this case, the phaco power was 60%, flow rate was 40 ml per minute, and vacuum was 400 millimeter of mercury. This is the last fragment. I remove the chopper. The posterior capsule goes backward towards the vitreous cavity. The chamber becomes deep and I safely emulsify the last fragment of the nucleus. Since I have made only one side port, I am not going to use bimanual in this case. This is a 23 gauge direct Simcoe cannula. We can even polish the posterior capsule like this with this very simple instrument. Now I go through the side port and remove the sub-incisional cortical lens matter. The cortical matter at 12 o'clock is removed. Going through the main incision, and that's it. The cortical cleanup has been done and the capsule has been polished. And now in this case we are going to implant a single piece hydrophobic intraocular lens under irrigation. Here it is. The leading haptic goes into the capsular bag. The optic and the trailing haptic goes into the anterior chamber, and the trailing haptic is guided by the left hand instrument into the capsular bag. That's it. Now this is a bit of moxifloxacin Now I hydrate the single side port incision on the left side of the main incision. And this is the final wash with BSS. Since I have not used viscoelastic substance for implanting the IOL, I have saved about 2 minutes time, which is required for cleaning out the viscoelastic substance. Dear colleagues, we must be very meticulous in every step of surgery. There can be some amount of viscoelastic substance in the lumen of the cartridge that must be thoroughly removed. In this case, I have used the irrigating probe of bimanual to go behind the IOL and irrigate that area. The antechamber is formed and the case gets over. Hope this video will be helpful in your practice.